using the NGCF method that you have been paying. The national and the county government and the NGCDF, we really want to urge all of us, the national, the county, the resources that you have as members of parliament, let us identify the indigent in our communities, use the social protection data, and let us pay for their SHA premiums for this important segment of our society. You can find this in the sponsors portal. We have a sponsors portal which is available at our website. This portal is known as Afya Yangu portal or app. You can use that if you have 100 and the CDF wants to pay for. You can use that to help the most vulnerable. Under the defunct NHIF, which was up to 6 months, depending on who you know, access to SHA benefits is very instant. As you are going to hospital, you can pay 1 month, you can pay 4 months, and you access. So it's not like NHIF where you have to wait for 2 months for the system to capture you. So it's very instant. The third question was the nature of covers offered by the authority at all levels. Honorable Speaker, SHA provides services as below. Number one, it provides free primary health care services at all public health facilities, level 2 to 4, and those contracted by the private and the faith-based facilities. And Mr. Speaker, this I really want to thank the House, because free primary health care is paid by government. It's budgeted by this House. And that is one of the things that has never been in our country, and that is why we are saying if you register and you go to level 2 to level 4, the dispensary, the health center, the sub-county, and their equivalents, both in the private and faith-based, you access, you are treated, you get medicine, you get everything, and you walk free, courtesy of your government. Additional services that Chief, the Social Health Insurance Fund, for all paid-up members available at level 4 to level 6, and all contracted private and faith-based facilities. Then we have the emergency services, as I said earlier, for all Kenyans. You don't need registration or payment required. Any emergency. For example, a boda is knocked down, God forbid, by a vehicle. He is rushed to a hospital. He doesn't need to register. He doesn't need to pay. Nobody can deny him. No facility can deny him treatment. And he walks away home. This is something that has never been there, but it is in law. Article 43, sub-article 2 of the Constitution, where at the Bill of Rights, require government to do that. The last one, service we offer is chronic and critical illness services for all SHA paid members at level 5 and level 6. The details of these services that the member have asked, Mr. Speaker, are set out in legal notice number 47. The NHIF was not required to publish, but this House allowed us. Those services you can access, and a legal notice number 47 was created. The gazetted benefits are a huge improvement from the previous benefit offered by the defunct NHIF. They are aligned to the projected collections. These benefits we shall continuously improve in tandem with available resources. For instance, Mr. Speaker, this month, SHA and the ministry, we have enhanced the ICU package from 4,000 to 28,000 per day. And additionally, we have increased 150,000 extra for all cancer patients. And that is because of that chronic and critical illness services. Mr. Speaker, the next one was about the referral system. There is 3 levels of healthcare services or access in the referral system as shown below in the document that I've given to the colleagues who asked this question. All registered SHA members, Mr. Speaker, can access outpatient services at the primary health facilities, level 2 and 4, free primary health care fund, which this House has established, courtesy of this House. So they access it for free. Number 2, Mr. Speaker, all inpatient services are accessed at secondary health facilities, level 4 to level 6. SHIF, which is the contributory arm of the universal health care or the Taifa care, and paid by Kenyans, is the where you can access those level 4 to 6 inpatients in those facilities, both public, private, and faith-based. For indigents, they will be paid by government of Kenya. They can be paid by our members of parliament through their NCGF. They can be paid by our county governments. They can be paid by good Samaritans and sponsors. And the last one is all specialized services are accessed at our tertiary facility, level 5 to 6. That is where we have emergency, chronic, and critical illness, which is again, courtesy of this House, is funded by the government of Kenya. So this referral system, Mr. Speaker, is aimed at decongesting the specialized facilities to allow them to focus on the provision of specialized services as contemplated under the Health Act of 2017. Mr. Speaker, let me explain this. Why do Kenyans go to India, to other countries to look for specialized facilities? It's because our specialized facilities, like Kenyatta National Hospital, like Moi Teaching and Referral Hospital, like Kenyatta University, are full with the patients that can be attended to at level 2, at level 3, at level 4. Somebody with a headache will go to Kenyatta Hospital. Somebody with malaria will go to Kenyatta Hospital. Somebody with a small scar accident. Our specialized facilities should be for special cases so that we stop Kenyans going out to look for special facilities. And I really want to ask this House to support me that the men and women who work in our specialized facilities should attend to Kenyans who require special needs and not for ailments that can be done at the other levels of our health system. The other question was on the empowerment of the health facilities. How do we know this is a health facility? How do we grade them? How do we find a facility? Unlike before, Mr. Speaker, a facility now must be licensed by the Kenya Medical Practitioners and Dentists Council and the Clinical Officers Council and all other regulatory bodies within the health sector. They must tell us this facility is at this level. This facility has all that is required to be part of the universal health care. So these facilities must be licensed by the regulator. And if the regulator is the one who audits these facilities, if the regulator feels this facility is not level 4, is level 3, then the regulator will stop and will advise SHA. Secondly, and more important, and NHIF, Mr. Speaker, used to accredit facilities itself, making facilities to pay for them to be empaneled even after being licensed. So it was who you know, it was how much money you pay for your facility to be accredited by the defunct NHIF. Now it is different. And when I had a meeting with the Council of Governors, we still had about 2,900 primary health facilities which have not been licensed, which we have asked them to give us the names which they have already provided, and the Kenya Medical Practitioners and Dentists Council and the other regulatory bodies within that sector will. The approved SHA staff establishment, Mr. Speaker, is a question that I was asked, is 815. And in line with the first schedule of the Social Health Insurance Act that this August House has passed, SHA has advertised positions and is giving first priority in the act that you have passed. The first priority will go to the employees of the defunct NHIF. NHIF staff who are not absorbed by SHA, because SHA is more of technology driven. The number will reduce. Those staff will be deployed within the public service. No one will lose their job. But let me do it with a rider. Your certificates must be genuine. If you are working at NHIF and your degree is fake, we will not only not post you to any other place, but we will refer you to the institutions within the criminal justice system that have done it. And we already found a number of them. The number, Mr. Speaker, corruption has permitted until people don't want to go to universities. They want to buy degrees. So please, members of parliament, I am sure many of you have approached me, telling me we have so and so working. Before I deal with those cases, ask your constituents who are working at NHIF, and I'm sure they're watching me. If their documents are in order, nobody will lose a job. But if your documents are false,